Okay, thanks very much, everybody. I'm delighted to be here and hope you're enjoying the conference so far. My name is Colin O'Gara. I'm a consultant psychiatrist here at St. John Hospital and also clinical professor at UCD. And I'm delighted to speak to you today about addiction service research and the work that we've been doing here at the hospital in addiction. So we are a very busy addiction service, and we focus on addictions to a whole host of issues. We divide, you can divide our work into detox in the first instance and rehab. They're the two main facets of work that we do, and by far and away the most common issue that we deal with is alcohol. And we also deal with a range of drug problems as well, stimulants, opioids, cannabis, and benzodiazepines in particular in the sedative group. As a psychiatric hospital, we also deal with regularly psychiatric comorbidity, meaning mental health problems. And critically, our research is clinical. It falls into the topic of clinical research, meaning that we're all very busy clinicians who have significant caseloads, teaching duties. We regularly have medical students and full multidisciplinary teams and colleagues that work with us. Our team members, apart from being expert in the clinical side of things, they're also research active and work with a whole host of collaborators nationally and in some cases internationally. So very lucky to have excellent colleagues in that regard. In more recent years, we have focused on process addictions. Prior to that, we've done research in pretty much all the different areas, including alcohol, drugs, and nicotine. Nicotine was the focus of my PhD. We're going back over 10 years now to completion of that work. But in recent years, it's definitely process addictions is what we've been focusing on. And what that means is substance addiction and non-substance addictions where there isn't particularly a substance involved. And the type of processes we're talking about are gambling, video gaming, known as internet gaming, sex, food, exercise, and there's probably a lot more rarer forms of process addictions also that we come across as well. Most common by far is gambling, and gambling is a big problem in Ireland at the moment. Gambling addiction in particular, or gambling disorder as it's known. We've been active in highlighting the deficits with regard to gambling, service provision, research provision, and regulation over the past few years. And this is an editorial published in 2017, which highlights basically that legislation needs to be enacted for the protection of players across a whole host of gambling products. Unfortunately, we haven't had any luck with that, and it's not looking great at the moment either, although there's some, as per usual, there's some commentary that it will get better, but at the moment it's not looking great. We wanted to get an idea of prevalence, and in doing that, we set out in probably 2012 onwards to do a national survey. We found it difficult to get our survey out there amongst a whole host of other surveys. We ended up with 200 people in that survey. We had certainly had designs in it being far bigger, but it was certainly a start, and it showed what we thought we would find, which was that sports betting and mobile device usage was the most common, with a lot of people in the sample, 75% of the people borrowing or stealing money to fund their gambling, which was even higher than we thought. And a good chunk of people in the population study felt that the harms of gambling should be advertised. Over the past few years, the service has been very keen to highlight deficits in responsible gambling initiatives in the country, and it's also a problem internationally, but particularly in Ireland, We're talking about real-time feedback, age verification, and limits on betting times, and the amount of betting spend limits as well. So we studied that with Caoimhe Cooney, who was our lead author in that paper, and that demonstrated significant deficiencies, as we expected, in responsible gambling tools and initiatives within the country. Service provision is the next area we wanted to look at, which, in essence, we thought that we would find very little of it. For many years, it's been proposed that an Office for Gambling Control would be initiated, of which would be funded. It would be funded by a social fund, which would come from a betting levy or an overall fraction of the overall turnover from the gambling operators. And unfortunately, that hasn't come forward yet. So the current service provision with regards to gambling is currently very poor in the country. There's a David Colin paper with Mark Griffiths, and we did that through freedom of information requests, and got a lot of buy-in into that study, and a lot of services and community health organizations and local drug task forces responding and helping us get the data together for that. Advertising is a huge problem in Ireland with regards to the overexposure of gambling ads, not only to adults but also children. In essence, there are too many ads and too often, and these ads do influence behavior and ultimately the development of gambling disorder. And the advertising, the harms of gambling are too limited in Ireland also. Again, this is a study that David Colin, as part of his MD thesis, led with a number of other clinicians that were working in the service at the time. And this looked at advertisements in various sports in Ireland and essentially demonstrated that the rate of these ads is, as expected, high, and is something that needs to be controlled. We have also focused on internet gaming disorder, which is a relatively newly recognized problem. There is an increasing sophistication of games and increasing sophistication of devices, hardware. This is basically leading to an addictive product. Of course, it's a controversial topic. Some believe that it is not addictive, that it is just overclassification, there's psychiatric disorder that is basically unnecessary. But we're beginning to see more and more referrals for internet use disorder, which is just generally the overuse of the internet, and also internet gaming disorder. We have highlighted this in, again, an editorial last year, highlighting the harms that are prevalent with gaming disorder, and then followed that up with a survey of gaming problems within Ireland, which showed that the prevalence is probably similar to international data as well. So with regards to the future, we have ongoing studies going in most of the areas: alcohol, gambling, gaming, inpatient rehab. So there's plenty of scope there, and if anybody's interested in doing work with us from a clinical point of view, if you're a clinician or otherwise, we'd be delighted to hear from you. So thanks very much for listening, and the best of luck with the rest of the conference. Hope you enjoy it. Thanks very much.